Welcome back. We're here with Honolulu plastic surgeon Dr. Shim Ching, and today we're talking about breast augmentation. Sorry, no pictures for this, you guys. Good morning, doctor.
Good morning,
so,
Diane.
first of all, people think breast augmentation is to increase the breast size, but it's literally to augment it in other ways. Asymmetrical breasts or shape correction, is that right?
Yeah, it is true. The most common reason is still to make the breast larger, but some women come in and one breast may be larger than the other, or they may be drooping, and all those things can be corrected.
Drooping, is that what happens to moms after they nurse?
Very often, unfortunately.
You were telling me about a new technique, endoscopic surgery.
Endoscopic surgery is a way where we can make small keyhole incisions and use specialized instruments so that we can actually see within the body. This makes the surgery safer. Usually there's less pain involved because the incision is smaller and there's less recovery time, and often the results can be very good because we're actually seeing inside the body when we're doing this.
Wow. So where do you make the incision?
I like to make the incision in the armpit because when the scar heals, it's almost undetectable. It's like having an invisible scar. There's no scar in the breast, and most women appreciate that.
And I did see a picture, but we want to err on the side of conservative, so we didn't want to show the picture, but the scar looked pretty tiny. I mean, how big is the scar?
Generally it's about 2 centimeters, 2.5 centimeters, so quite small. And then we put it right in one of the prominent wrinkles in the armpit, so when it heals it's very hard to see.
But you do make incisions elsewhere, right? Like on the front side, on the breast? What do I say?
when we do the surgery that way, generally we just use the one incision. But for various other reasons, sometimes we do need to make an incision on the breast itself. Okay,
so you say you're a proponent of the endoscopic surgery because, well, what are the advantages? Controlled bleeding, etc.?
Yeah, exactly. Sometimes the surgery can be done without endoscopic instruments. In that case, none of the bleeding is controlled. By using it's actually like a telescope. We can actually look inside the body with a camera, and we can use instruments that can control bleeding, make an exact space for the implant so that the results can be have a higher success of symmetry and the appropriate shape and so on.
All right, let's talk time frame. How long does it take to do it? I mean, can I do it over lunch?
You could. It only takes a couple of hours, so it'd be a little bit of a long lunch, but you wouldn't feel too good
I cut
after.
my hair.
Yeah.
And then the recovery?
Usually about a week for people to go back to light work. Yeah.
Okay, interesting. And then who's a good candidate?
Pretty much anyone who really wants to, increase the size of their breasts, there's many people who are good candidates.
Okay, and then you also wanted to talk about rhinoplasty, some advancements in that.
We're offering a very exciting new technique now, and this just involves an injection of a filler substance into the nose. So because our population here is predominantly Asian, many people want to increase the size of the nose, the bridge of the nose, and so on. And just with a very quick injection in the office, usually taking between 5 and 10 minutes, we can really change the shape of somebody's nose without any downtime and without much discomfort at all.
Okay, so on the right side of the screen, that was the before, and then on the left side was the after, right?
Exactly, yeah.
That's really subtle.
Yeah, and that's immediately after. And most people aren't looking for a big change in their nose. They just want something that changes their look, and many people desire a stronger bridge of the nose, and sometimes we can increase the tip of the nose, the projection of the tip of the nose.
How long does that last?
6 to 12 months.
Okay.
If we have a side view, that would really show it well too.
Interesting, interesting. Okay, well, thank you, Dr. Ching. Sorry, we don't have the side profile right now.
No problem.
But if people want to know, I know they can go on your website. What is it?
www.drshimching.com.
Okay, thanks a lot, Dr. Ching. We're going to throw it to break. We'll be right back.
Products and services have been provided by the